people must identify who a trained, certified, licensed nurse is. More often than not, when people enter any healthcare facility, the moment they see a woman, and remember where we're coming from, they see the person in uniform, and it was because it was nurses that used to wear uniform for identification. They enter the place, they see a woman because a woman is supposed to be the person who is supposed to be caring, and they see the person in uniform because it is the nurses that wear uniform. And in the past, they see the cap because it is the nurse that wears the uniform and wears the cap. But now we know that it's not only nurses that wear cap. Chefs also wear caps. They also wear uniform. The people just automatically assume that that person will be a nurse. And the average person who is a female also wants to be called a nurse. So rather than people saying, I am not a nurse, they also will just respond like that and say, how may I help you?
How do you identify a qualified nurse? A qualified nurse at work should have a name tag. Okay? A qualified nurse at work should have a license by Nursing and Midwifery Council of Nigeria. A valid one, not expired nursing license.
Ever. There's a distinguishing thing that tells you who is a nurse. And we must begin to insist on seeing such things. And if you see any nurse that does not have his or her registered nurse Nigeria pin on her chest and with her name tag, then we should ask that person, are you really a trained, licensed nurse? Because the moment that person cannot give you an answer, then know that your life may not be as safe as you assume. The essence of saying educate a person, train a person, license that person to practice, and give that person an identification, and insist the person must have a name tag, is that when anybody attends to you, you can identify who that person is. Because legally, if the person fails to perform to the expected level of professional practice, that person can legally be taken up. And that person can be professionally challenged by the regulatory body and in law. So if you don't see this, and when you see this and the name tag is not there, you also should ask the person or question the person that, am I really speaking to a registered, licensed nurse? There are certain things that tells you who a nurse is. You will see this pin, and then you will see some pockets. And now that our nurses wear scrub, when you look at the pockets that the average nurse has, they are meant for different things. You will see a pocket, inside the pocket you will see the space for the scissors. Okay. You will see the space for blue pen, blue or black, and the space for red. Because if there is any professional group that collect data, and enormous data, nurses do. Okay. Because they have to write most of the time, because they must communicate their observations. And if the person does not have this pen, you also will see the nurse, an average good nurse who knows what it is. You will see this pin. You will see what we call the nurse's watch. I think I have one around here. The nurse's watch that will be on the side, because the nurse's watch is what the nurses use. What the nurses use, what the nurse will use when she has to take the vital signs. And the nurse's watch is the small one that it's put like this and has seconds. Well, that's what she's going to be using to check the pulse, or when she's checking the breathing or checking whatever, and that has to be there all the time, because as she walks around the ward, she will pick at any point in time when a person needs to be quickly checked and there is a need to call people who need to be there. So, you know, those are things But those are material things that are available in the public. But the things that will distinguish a trained nurse from quacks are all these identifications. And beyond this, we have also added getting lapel pins from institution of training. All our graduates from IFE have the identification pin. This was what we were using before. And it is mandatory for them for identification. It's not just enough to say, I'm a registered nurse. It's also important for you to say where you have been trained, so that when people, because we usually ask for feedback from the public about our graduates. So I think we need to begin to do a lot of education of the public also about who is a nurse, what should they be expecting, and what should they be asking for. Because if you know your rights and you demand for your rights, and you are able to say, this person did this, everybody keep on just summarizing nurses as they are very bad, they are this, and we tell people that there are laws. If you report a nurse for misconduct, there are regulations, there are rules, there are committees that are there, even at the local level, to take over misconduct among health professionals. But you can't say because one nurse or one assumed nurse, who may actually be a cleaner on the ward, that wears a uniform, or somebody trained by another person who is not a nurse, who do not even know what nursing is, but train that person to be like those people trained by the first missionaries, to be able to say this is a gallipot, whatever, and you just say that person is a nurse. And we do not have ways of insisting on doing what is right. You also experience things you do not report. There's no way we're going to be taking people up. And I tell people, when people say nurses are bad, I tell them that, how many nurses do you know? How many have you experienced? How many have been bad to you that you have reported? Have you ever experienced a nurse that is good? And did you mention the one that was good? Because in every profession, there are bad eggs. And besides, we do work, but we also carry baggages of social challenges that people take to their places of work, that we also must be helping to undo. And if you have a person that is truly professionally bad, we should have means and ways of taking them up.
And update yourself through trends, current trends in nursing, current administrative trends in nursing, and at the same time, you also go in for the mandatory professional development program for nurses. So with all these certificates, then you can put them together to renew your license and have a valid license to practice as a nurse in Nigeria. So for you to identify a nurse, it's not by uniform.